You're welcome back, and it's still Good Morning Nigeria. Now let's talk health, as West Africa Health Organization, WAHO, is the specialized institution of the Economic Community of West African States, and that's ECOWAS for health issues.
Now, WAHO, that's the West African Health Organization, was established by ECOWAS, that's the heads of states and governments, with the sole purpose of ensuring the highest possible standard and protection of health of the people in the West African sub-region through the harmonization of the policies of member states. Now, WAHO has been in existence for some years, and here to talk more about WAHO, its activities, and what it has been on to lately with regard to safe motherhood, we have joining us the Director General of the institution, Professor Stanley Okolo. Professor Okolo, pleasure to have you with us on Good Morning Nigeria.
Thank you so much.
All right. Now let's begin by generally, looking at WAHO. I'm sure most of our viewers are perhaps more familiar with WHO, and this one is the West African Health Organization, WAHO. Tell us some more. Where are you located, and what have you been up to, and for how long have you been in existence?
West African Health Organization is the specialized institution that was set up by the heads of governments and states of 15 countries of West Africa in 1987 by statute. And what they really brought the organization together was to try and bring the region together in terms of health issues, in terms of developing and promoting policies and networking across the 15 countries to promote the highest standard of people. And incidentally, although we have been in existence for 31 years, this is the first time that a Nigerian is heading the organization. And it is located in, the headquarters is in Bobo Dioulasso, which is the second city of Burkina Faso. And we have had a lot of programs and achievements which are geared towards some of those issues that are the critical issues in terms of raising health. So if you remember clearly, when our region was hit by Ebola in 2014, the organization that brought together a lot of the countries to support each other and also use both technical support and financial support through our funders was West African Health Organization.
So you've been in existence for 31 years now.
31 years.
Could you shed more light on your achievements? Of course, you just talked about the issue of the Ebola. Yeah. What are the other achievements you've had in the last 31 years?
Yes. In the most recent past, what we have done is we have set up the Regional Center for Disease Control, which you know about. It's in Abuja here. It was opened by the Minister of State for Health in February, and that is mainly in terms of surveillance for epidemics and in terms of emergency response. We have assisted several countries, including when Nigeria had the Lassa fever. We have done issues in terms of harmonization of medicines policies across the countries. We have also resulted in training people, helping people in terms of human resources for health. We have done a lot of training for people in Nigeria. We've built up capacity of up to 1,000. Across countries, particularly cross-border issues, along the Sahel region, so Burkina Faso, Mali, Niger, we have done a lot of programs in terms of river blindness, malaria, Sahel malaria issues. And so West African Health Organization on its own does actually help improve regional health issues that matter to the people. Infrastructure-wise, we have also given technical support. At the moment, we are helping build a center between Liberia and Sierra Leone. You may not be aware, your viewers may not be aware, that we have issues of vaccines and medicines security. We actually have storage of vaccines so that when certain countries run out of vaccines, they can come to us and we deliver that to them. We also have bulk purchase. And at the moment, what we are now looking at in terms of how we move forward is how do we bring the 5 major thematic areas that I have developed since taking up office in March this year in terms of looking at maternal and child health and adolescent health. Pharmaceuticals, we still have a problem of fake drugs in our region. How do we ensure regional manufacture, which ensures quality and security? Looking at communicable and non-communicable diseases, you know that a lot of people are dying because of hypertension and diabetes. It's not just only the epidemics that we're being careful about. And also looking at issues of quality standards and centers of excellence. $1.2 billion is what we estimate that people from our region spend in going on medical tourism, to India. We can have centers of excellence in our region. And also, finally, making sure that we have region-specific health information so that we are on top of what are the major health issues and how to respond to them.
Well, right now, what are those major health issues in the West African sub-region? Because, I mean, the commonest some persons would say will be malaria, and malaria is still rife.
You're absolutely right. So malaria is one, that's why I mentioned that it's one of the tropical diseases. Malaria itself is not necessarily tropical, but it's one of those diseases that is not necessarily an epidemic, but that we must have to get on top of. Particularly children under 5 dying of malaria. So the drive and the things that we're now trying to do is to scale up the, you all know that the issues of treated nets and things has helped reduce malaria. But in terms of the fact that in some of our areas, malaria is again going up, we are looking at why is this happening? Is this due to climate change and therefore mosquitoes are therefore becoming itself more rampant? Or is it because of some resistance to some of the drugs? Some of those comes up. And so we are also now, WAHO, our organization, is going in partnership with NEPAD to try and look at integrated vector management in terms of understanding how we can tackle malaria. We're also having discussions with some of our funders, including Global Fund and including some of the governments that are trying to help us in our region in how we tackle the treatment for under 5 malaria, children under 5.
Well, you just, before you came on set, you were speaking to us about research and the need to transfer from research to, more practicable after the research, making it more practicable. I'd like you to share more insight into this research that is being done.
Right. So we have a program, an event going on in Nigeria at the moment, which is run by and put up by the Federal Ministry of Health. They've done a fantastic work in terms of trying to get people who have bid for research. WAHO was the organization that Canadian government put in some money through WAHO in order to sponsor some of those research. And at the moment, what the event is that people who have done some research in Bauchi, in Edo, and in Ibadan came together to try and present some of the work they've done on maternal health and women who have, how do we improve the outcomes in terms of women who are pregnant. So some people have used rapid SMS using telephones to get women onto the healthcare workers. You, of course, know about the ABIA program that was very popular and well established that was done in Ondo. So we got the ex-governor of Ondo State, Mimiko, to come and give the keynote address during this event. The whole purpose of this was that we brought together policymakers from the Federal Ministry of Health, the directors and all the people, and the researchers, bringing them together to show these are the evidence of what works. How can we now take this and go into policy?
Well, what were the findings of this research?
Some of them showed that you improve the uptake of people going into hospitals, of people being treated by skilled attendants as opposed to traditional birth attendants, and subsequently you reduce the number of deaths, so you improve maternal mortality rate. The one done in Bauchi was quite interesting because also what they did was not only did they try to explain in terms of how people can go, but they gave them tablets, like iPad, but not iPad, and they use it as a way of doing distance communication and distance consultation. And that again showed that it brought in a lot of more women into the scaled health. One principle is that the percentage of women who are pregnant that have skilled birth attendants or skilled healthcare people looking after them, the more you provide the transport to make sure that you get them into higher centers, whether it's secondary or tertiary, the more you reduce the delays at all aspects of care, including at tertiary care, you reduce maternal mortality. So the question now we have is not so much about the big hospitals, it's what do we do at the primary health centers? How do we scale it up to impact on the people? And that is the beauty of this.
From what some of us get to know about primary health care, Nigeria is only now just trying to ramp up its PHCs after the earlier pioneering effort of Professor Olikoye Ransom-Kuti. What is the story from elsewhere in the West African sub-region with regard to the state and status of primary health care, which will be a focal point for trying to ramp up maternal and child care?
There is always a challenge in terms of various countries of West Africa regarding what happens with primary health care and what happens with the traditional district hospitals and secondary care and tertiary care. But let me just say this. There is a vast improvement in terms of focus on primary health care across West Africa. In fact, some of the challenges that we are beginning to see now is that some countries in West Africa have free health care in terms of particularly women and children under 16, but also have general free. But the financing has become an issue. The second aspect that we have a problem in is in terms of ensuring the governance regarding health systems. So how do you set up the system such that even though you have the primary health care and the secondary care, they are not detached from each other? How do you ensure that you have that contribution? And so what we find is that actually across West Africa, particularly in areas that are the ones that have a lot of free healthcare, primary healthcare is very strong, very strong. And that's what Nigeria is doing, because remember that Nigeria is a population of estimated of about 180 million. The population of West Africa is 340 million. So really, when Nigeria can ramp up its primary health care, which we're doing now in the country, it does improve.
Are there any stellar examples from any one or two countries in the West African sub-region with regard to the issues you just touched on, primary health care and attention to maternal and child health?
Well, there are examples. We have what is called a best practices forum. And in our best practices forum, we bring people together to try and look at what is happening in those countries. So there are things happening in Ghana, there are things happening in Senegal. I've already mentioned things happening in Nigeria, from Ondo, from what is happening in terms of the research work done in Bauchi. Edo State used telephones. At Ibadan, they did some work in terms of looking at women's mental health. So there are examples across West Africa. My driving ambition coming into this role is really to try and see how we scale up these for maximum population. So it's not more a question of we know that there are these hidden nuggets, and we were very lucky and very fortunate that the Minister of State for Health came to the meeting himself to try and assure us that all those research work, all those small programs, that the government has seen them and accepted that these are things that will be useful. Now, the question is how to operationalize it in terms of bringing up each top to population impact. And I'm absolutely happy and convinced that there is that understanding that we now have to move from small scale to big scale.
All right, finally, I'd like to just ask you, just as you said, you took over the leadership in March this year. Well, what's your vision for the organization, pending just when, for the time frame that you will be there? Moving on, what will be what's your plan, what's your vision?
In those 5 thematic areas that I have illustrated, my vision is that we will try as much as possible to have tangible legacies that we will leave. So, for example, although we will be working with all 5 areas, making sure that we build human capacity in terms of developing our people, making sure that we strengthen the networks across West Africa, making sure that the programs are sustainable. The tangible things that we would like to see are, for example, we want to have large regional manufacture of drugs within our region. We want to ensure that we can develop a health observatory within our region, and we would like to know that the maternal mortality rate, the under 5 mortality rate, starts coming down in our region, so that we can aim to go towards the SDG rate. You know what the SDG goals are.
All right, Professor Stanley Okolo, Director General, West African Health Organization, would like to appreciate you. You have already indicated your 5 thematic areas. I'm sure that going forward there will be an opportunity to discuss the issue with regard to the epidemic of fake pharmaceutical products in Nigeria, for instance, and I believe elsewhere in the West African sub-region, plus communicable and non-communicable diseases. And we do hope that West Africa will be a lot healthier at the end of your tenure. Professor Stanley Okolo, thanks a lot for being around on Good Morning Nigeria.
Thank you so much.